Okay, I think we're going to go ahead and start. Jennifer, would you like to go ahead and introduce yourself and your two speakers?
Yes, I would. I am a pharmacist at St. Mark's Hospital. My name is Jennifer Bishop. If you want to go to the next slide, Austin, I am really excited that you are going to hear from our PGY1 pharmacy residents. And for those who don't know what a pharmacy resident is, they are doctors of pharmacy who have graduated pharmacy school and then have elected to do more training through a residency program, similar to what a doctor might do, except that it's usually limited to 1 or 2 years. It's a very, very competitive thing to match with a residency program. So I always say the residents are the best of the best. So I'm really excited to have you hear from them today. And I think that's all I was going to say. The first person who is presenting, I think, is Aaron, right? Aaron. And sorry, I should say Dr. Tebow. And then the other, he'll pass the baton off to Dr. Lang and go back and forth. So thank you so much for taking the time. I will also read the learning objective for you. We were asked to speak on transmission of or preventing infection in the community. And since we are still dealing with the SARS-CoV-2 virus, we decided to dedicate most of our presentation to the COVID-19 pandemic. So we are going to summarize the transmission and risks associated with SARS-CoV-2, identify preventative measures against COVID-19, compare the different COVID-19 vaccines, differentiate the symptoms of common viral respiratory infections, manage active COVID-19 illness with OTC medications and non-pharmacological therapy, and finally, we'll talk about when you need to go to the hospital. Next slide. And I will turn it over to Dr. Tebow. Thanks.
Thank you, Jenny. Appreciate it for the introduction. So before we really jump into what we're going to mostly focus on, which is COVID-19 and then viruses, I really want to give a background on pathogens or germs and the different type of germs that can cause infections. So those pathogens include fungi, virus, and bacteria. They're similar in the fact that they can be harmful to the body, but they are different from each other. We might recognize different fungal infections as athlete foot, ringworm, or vaginal yeast infections. Different viral infections include COVID-19, obviously, influenza, the common cold, HIV, measles. Those are a couple different viral infections, and bacterial infections that we might be able to recognize is if you have a urinary tract infection with E. coli, that's one type of bacterial infection. Or like if you have C. diff, which is just a bad digestive tract bug that can cause a lot of diarrhea. Fungus and bacterial type infections are similar to each other in the fact that they're actually living organisms. So they actually do not need a host to survive, whereas viral infections are non-living organisms. They need a host to survive. They replicate once they find a host. A host is like an animal or humans like us, so COVID-19 can't survive on its own, or it won't replicate, I should say, but once it gets into our system, it can start replicating and causing an infection that way. And another big distinction between the three of them is that fungi and bacteria can actually be beneficial to us, where we do have a lot of bacteria on our skin and in our digestive tract, whereas viruses are most of the time or all the time typically very harmful to us. So like I said, for the rest of the presentation, we'll really focus on viruses for the remainder of it and really get into COVID-19 specifically. But as I said a while ago, viruses can really accompany a bunch of different infections, or they can cause a bunch of different infections. They can cause respiratory infections, and then as well as chickenpox, measles, and HIV, and many others. As for the respiratory infections, I said the common cold, influenza, and COVID-19. These are all very similar to each other, and I'll talk about the differences or Austin wanted to talk about the differences later into the presentation. But one important thing I want to talk about these is that they can be passed through a couple different ways from one person to another. One specific transmitted way is through respiratory droplets, which is essentially your saliva in your mouth. So when someone talks or they sneeze or they cough, they kind of expel respiratory droplets from their mouth. And if you're in close proximity to someone, someone can inhale those respiratory droplets, and if they have a virus in them, they can now infect that next person. Along with that, they can also be transmitted through inanimate objects. So let's say I have COVID-19 or a different type of virus, and I end up touching a door handle. I now kind of put the virus on that door handle. So if someone else goes and touches that door handle, they now have it on their skin. And if they were to touch their nose, mouth, and eyes, they can now infect themselves. So we do have a little video kind of explaining COVID-19, and it does a great job kind of giving background of it and a great explanation of it. So we will watch this small video and then we'll get back to the presentation.
In December 2019,
Are you guys able to hear the video with us muted?
No.
Okay, we'll back it up and start again. Sorry about that.
in December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when it infects a human, and what should we all do? A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen, or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation. The lungs are lined with billions of epithelial cells. These are the border cells of your body, lining your organs and mucosa, waiting to be infected. Corona connects to a specific receptor on its victim's membranes to inject its genetic material. The cell, ignorant of what's happening, executes the new instructions, which are pretty simple: copy and reassemble. It fills up with more and more copies of the original virus until it reaches a critical point and receives one final order: self-destruct. The cell sort of melts away, releasing new corona particles, ready to attack more cells. The number of infected cells grows exponentially. After about 10 days, millions of body cells are infected and billions of viruses swarm the lungs. The virus has not caused too much damage yet, but corona is now going to release a real beast on you, your own immune system. The immune system, while there to protect you, can actually be pretty dangerous to yourself and needs tight regulation. And as immune cells pour into the lungs to fight the virus, corona infects some of them and creates confusion. Cells have neither ears nor eyes. They communicate mostly via tiny information proteins called cytokines. Nearly every important immune reaction is controlled by them. Corona causes infected immune cells to overreact and yell bloody murder. In a sense, it puts the immune system into a fighting frenzy and sends way more soldiers than it should, wasting its resources and causing damage. Two kinds of cells in particular wreak havoc. First, neutrophils, which are great at killing stuff, including ourselves. As they arrive in their thousands, they start pumping out enzymes that destroy as many friends as enemies. The other important type of cells that go into a frenzy are killer T cells, which usually order infected cells to commit controlled suicide. Confused as they are, they start ordering healthy cells to kill themselves too. The more and more immune cells arrive, the more damage they do, and the more healthy lung tissue they kill. This might get so bad that it can cause permanent, irreversible damage that leads to lifelong disabilities. In most cases, the immune system slowly regains control. It kills the infected cells, intercepts the viruses trying to infect new ones, and cleans up the battlefield. Recovery begins. The majority of people infected by corona will get through it with relatively mild symptoms. But many cases become severe or even critical. We don't know the percentage because not all cases have been identified, but it's safe to say that there is a lot more than with the flu. In more severe cases, millions of epithelial cells have died, and with them, the lung's protective lining is gone. That means that the alveoli, tiny air sacs via which breathing occurs, can be infected by bacteria that aren't usually a big problem. Patients get pneumonia, respiration becomes hard or even fails, and patients need ventilators to survive. The immune system has fought at full capacity for weeks and made millions of antiviral weapons. And as thousands of bacteria rapidly multiply, it is overwhelmed. They enter the blood and overrun the body. If this happens, death is very likely. The coronavirus is often compared to the flu, but actually it's much more dangerous. While the exact death rate is hard to pin down during an ongoing pandemic, we know for sure that it's much more contagious and spreads faster than the flu. There are two futures for a pandemic like corona: fast and slow. Which future we will see depends on how we all react to it in the early days of the outbreak. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst-case scenario for a fast pandemic begins with a very rapid rate of infection because there are no countermeasures in place to slow it down. Why is this so bad? In a fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare systems become unable to handle it. There aren't enough resources like medical staff or equipment like ventilators left to help everybody. People will die untreated. And as more healthcare workers get sick themselves, the capacity of healthcare systems falls even further. If this becomes the case, then horrible decisions will have to be made about who gets to live and who doesn't. The number of deaths rises significantly in such a scenario. To avoid this, the world, that means all of us, needs to do what it can to turn this into a slow pandemic. A pandemic is slowed down by the right responses, especially in the early phase, so that everyone who gets sick can get treatment and there's no crunch point with overwhelmed hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine. This simply means two things: not getting infected and
All right, as you can tell, that video is a little outdated, but I thought it did a great job explaining coronavirus in general. I think that video came out in March of, or April 2020, so it's about a year and a half old. We do have a vaccine at this point, and we kind of see the course of what coronavirus has done for the past year and a half. Anyways, getting back into the presentation, then I'll start talking about preventative measures, and we're probably all very familiar with preventative measures for COVID-19 because we've been doing it for the last year and a half. But I'll talk about washing your hands, social distancing, and wearing a mask. All right. So how to properly wash your hands. So this may seem elementary, I guess, but we as people, we typically do kind of miss important steps in washing our hands, whether we're not thoroughly washing our entire hand or not doing it long enough. So when we're not doing it long enough, we're kind of not thoroughly doing it enough at the same time. So we miss specific parts of the hand, whether that be the thumb, between the fingers, or on top of the hand. So it's very important that we do wash our hands for at least 20 to 30 seconds and also trying to hit every part of the hand. Along with that, it's also very important that we dry our hands off completely. If we wash our hands and leave our hands wet or damp, germs do a lot better job at sticking back onto the hand if you keep it, if they're not dry. So it's important that we do dry the hands. And I did like this graphic, so we threw this in here. Basically, what we're seeing in this picture is someone used a cream called Glow Germ. It's a mineral oil that clings to germs and is only visible under UV light. So in the top left-hand corner, that's what the cream looks like under UV light without washing your hands at all. As you move through the picture from left to right and then top to bottom, the person ends up washing their hands a little bit more and a little bit more thoroughly. And you can see the progression of how the more thorough you wash your hands, the better you take off the germs, essentially. So in the second picture, she just did a rinse and shake. You can still see all the germs by the brighter UV light. In the next picture, you see they did it for 6 seconds with no soap. But again, with no soap, you're not really killing the germs. Yes, you get some of it off your hands, but you still have a lot in your hand. Once you start introducing soap into washing your hands, you can see that you kill a lot more germs as the UV light's a lot less in these bottom pictures. But even then, compared to the fourth picture to the sixth picture, where you're washing your hands for 30 seconds compared to 6 seconds, you hit those spots that you could possibly miss, like between the fingers and the thumb. So again, I thought this was a pretty cool visual to just show like the importance of thoroughly washing our hands and using soap. The next preventive measure is wearing a mask. Again, we're probably all very familiar with this and how to properly wear a mask, but I still want to talk about it anyway. So what we see in this visual is a person who has COVID and someone who is a healthy person, who's in close proximity with each other. And what we see is that these red dots between each of the people, and the red dots represent those respiratory droplets that I was talking about earlier that could possibly contain COVID-19. So when you're not wearing a mask, in the top left corner of the picture, you can actually see that there's a lot more, a way higher concentration of red dots or the respiratory droplets, increasing your risk of spread of COVID-19 from one person to another. As you can move along through this graphic or through this picture, when someone does wear a mask, it significantly reduces the amount of respiratory droplets between one person and another, and also reducing the risk of spread. With that being said, it's important to wear the mask properly in order for it to be effective. And in order to do that, you really want to cover your nose and your mouth because respiratory droplets can be excreted from both of those areas. So you want to be able to pinch it over your nose and have the mask come all the way down over your mouth in order to kind of contain all of the respiratory droplets when you talk, cough, or sneeze. And then we also put a couple do's here in how to properly handle a mask and really reduce the amount of possible infection and spread. But before and after you ever touch a mask, you should wash your hands because every time you touch your mask with your hands, you have germs on your hand, as we just discussed. So when you touch your mask, you're transmitting those germs from your hands to your mask. So then you can breathe those in and it can cause infection that way. So again, it's important to always wash your hands. And when you do handle the mask for that same reason, you also want to remove it or place it back onto your face with the loops that are supposed to go around your ears. So you are not breathing in those germs again. And then if your mask is dirty or if it does become wet, you want to throw it away. Or if it's a fabric mask that someone gave you or made, or if you bought it, you want to make sure that you wash it frequently, and it's recommended daily if you do wear it daily. And then another preventative measure is social distancing. Again, we're probably all very familiar with social distancing as we've had to do it for the last year and a half now. But if you're not feeling well, or if you're in an area that could possibly have a high infection risk with COVID-19 or any disease for that matter, it's important to really keep your distance from others to really minimize the spread. Again, we talked about how the transmission of COVID-19 is biggest with the respiratory droplets. So the further you are away from someone, the less respiratory droplets could possibly reach you, reducing the possibility of getting infected. So social distancing is very important. And then, oh, that's a good question. So sorry, we just got a question. That's why I paused. So we got a question saying, does the soap need to be antibacterial? No, you can use hand sanitizer as well. Hand sanitizer is very great at killing viruses or other bacteria on your hands as well. So you can use either or. And it kind of goes the same way with using just soap. You want to make sure you're thoroughly doing it for a correct amount of time. And if you're using hand sanitizer, you want to keep rubbing until it's dry. But that was a good question. Thank you. Continuing with this slide. Yeah, so for social distancing, you want to make sure you keep your distance. And if you're feeling unwell, definitely keep your distance in that sense. And you should probably actually be staying at home, especially in the middle of a pandemic, if you feel like you're feeling unwell. And with that being said, you still want to continuously wash your hands, even if you are social distancing. And then the last preventative measure that we will be talking about is vaccinations. And Dr. Lang will get into that.
So yeah, Jenny also mentioned here, saying that no, the mechanism of soap without antibacterial is beneficial. There's evidence that soap with antibacterials in them might lead to further bacterial resistance. So regardless, having the soap on your hands and rinsing it off, it helps to grab onto the germs and pull them off, and you rinse them down the drain. So that's why it's important to not only wash them with soap, but wash them for an extended period of time. That 20 to 30-second range does a pretty good job, as Aaron showed in that picture. I'll kick it off here. My name is Austin. I'm going to talk a little bit about the vaccines. The video kind of started to allude to the possibility of vaccines, and obviously we've reached the point where we do have some available. So currently, let me just click this part of the screen. All right. Currently, we have 3 vaccines available to fight against the virus. 2 of those being mRNA vaccines, and 1 of them being a viral vector vaccine. So the ones that are orange here, Pfizer and Moderna, those are the mRNA vaccines, and the Johnson & Johnson, the J&J you can see on the right here, is the viral vector vaccine. All 3 of them, through the clinical trials they conducted, significantly reduced the hospitalizations and deaths associated with COVID-19. These vaccines were released through a emergency use authorization. What that means is the FDA approved a medical. There was no approved medical product or approved uses for coronavirus. So because of that, there's a life-threatening disease and condition in the community, and with the clinical trial data that showed such a strong effort to fight the virus with the vaccines, they introduced them through the emergency use authorization. Since then, millions of people have become vaccinated, and the rate of COVID-19 and deaths has gone down tremendously within the vaccinated community. We'll talk a little bit more about that. And now also, Pfizer vaccine is fully FDA approved, which we'll talk about as well. But as far as mRNA vaccines, the Moderna and the Pfizer vaccine, those are mRNA vaccines, mRNA meaning messenger RNA. And in the video, you could see how the virus kind of implanted on the cells in the lungs and then kind of released information into the cells. It's passing along, the virus is passing along its messenger information. So this vaccine introduces very similar information that they got from the virus into the body, so that the body can recognize and create a response and fight the virus when and if it does happen in your body. So mRNA vaccines in general have been studied by hundreds of scientists for several decades. They've studied this in previous SARS-CoV viruses, influenza, Zika virus. No current virus that's been introduced to the community that has been mRNA, but now that they've had the research and the trial data that they had prior to 2020, and then using the COVID-19 vaccine and seeing the benefit in being vaccinated, there was comfortability in releasing mRNA for the first time in the community. And again, since then, hospitalizations and deaths has been tremendously blunted. So that leads us into talking about the Pfizer vaccine. Many of you may already be vaccinated and might have already had the Pfizer, Moderna, or J&J. We'll just do a brief review. And for those who have maybe not been vaccinated yet or are looking for a booster shot, we'll talk about all that as well. So first things first, the Pfizer vaccine, it's a 2-dose series. So you have to get 1 dose, wait about 3 weeks. Doesn't have to be exactly 21 days, but you want to get as close to that as possible. And you get a 2nd dose. After getting that 2nd dose, you still have to wait about 2 more weeks before you're considered fully immune. Your body's still mounting that immune response to the vaccine after the 2nd shot. So after about 2 weeks, you consider yourself fully immune. This vaccine is approved for children 5 years all the way up and older. So it's the only of the 3 vaccines that can be used in children, and it is fully FDA approved as recently as this, just a couple months ago, it got recently fully FDA approved. For the Moderna vaccine, very similar, an mRNA vaccine. However, the timing is a little bit different. So 1 dose, and then 4 weeks later, about 28 days. And again, it doesn't have to be exactly 28 days. If you miss a day, you can still, you should still seek out that 2nd dose. And from there, it's 2 weeks after that 2nd shot to be considered fully vaccinated. So that's about 6 weeks in total from the first shot to the 2 weeks after the second shot. And I didn't mention it, but the Pfizer's first shot, 3 weeks to the second shot, and then 2 more weeks would be 5 weeks. So 5 weeks to full immunity for the Pfizer and 6 weeks for the Moderna. And as I mentioned, the Pfizer vaccine is the only one approved for people under 18. So if you're getting the Moderna vaccine, it has to be for 18 and up. And finally, Johnson & Johnson's viral vector vaccine. And viral vector vaccine means that it's different from mRNA, as it's embedded with the virus, kind of similar to that envelope you saw around the virus. It's kind of packaged in that way, and it contains the coronavirus's DNA, and it makes a similar protein that recognizes the spike, and that's how your body mounts an immune response. One of the benefits in the Johnson & Johnson vaccine is it's just a one-dose initial series. So you get one dose, 2 weeks later, you're considered to be fully vaccinated and fully immune from the virus. And again, this one is only for those 18 years and older. So children are not yet approved to use this vaccine. All right. Now, there's a lot of conversation lately about an additional dose or a booster shot. So we'll talk a little bit about that. The difference between an additional dose and a booster, it may sound very similar, and that is because they can seem that way. An additional dose is recommended for those who are immunocompromised. It's often said that people who are immunocompromised would know they're immunocompromised, and that's because they are enduring some sort of disease state or illness that either they're experiencing therapy like cancer treatments, chemotherapy, they're taking maybe some corticosteroids to help with their illness that they're experiencing, or maybe they had some sort of organ transplant. So those people are considered immunocompromised. If there's any question whether you feel like you are, it's certainly okay to reach out to a healthcare provider, but it's all likelihood you probably know. On that same account, an additional dose is for those people. So it's 28 days after the second shot of Pfizer or Moderna. So for Pfizer, after that second shot at 3 weeks, you're going to wait 28 more days or 4 more weeks and get another dose. And then you would be considered fully immune after that. For the Moderna, 4 weeks after that, you're going to have 4 weeks between the first and second shot, and then another 4 weeks after to get that additional dose for an immunocompromised person. In the J&J vaccine, they're not currently recommending an additional dose for people who are immunocompromised. Now, for the booster shot, that's a little different, and that is it would be a third shot for Pfizer, Moderna, and a second shot for Johnson & Johnson. And if we slide to the bottom left, for Pfizer, Moderna specifically, anyone who's 65 years old and older should get a booster shot, and that should come 6 months after their second shot. So they're going to do 3 weeks, first shot, 3 weeks later, second shot, and then 6 months later, they should get a booster shot. Similar for Moderna, 1 shot, 4 weeks later, second shot, and then 6 months after that, a booster shot. And then for 18 years and older, you may receive the booster shot, and it's recommended for people with underlying medical conditions similar to hypertension, diabetes, obesity, things like that. The CDC has a list, and it gives a good representation of who should get a booster shot. So if you have any question, feel free to reach out to healthcare providers or ask us, or your pharmacist, wherever you stop, and see if you would need a booster shot. For the Johnson & Johnson vaccine, it's a little bit of a shorter time frame. It's going to be 2 months. So you're going to get their first shot, and then 8 weeks later, get a second shot of your booster. And that's everybody. All people should get a second shot of a booster for Johnson & Johnson. So you might think, well, if you're vaccinated, when did you get vaccinated? If you got vaccinated in May of this year or earlier, and you're in the categories of 65 plus or 18 with those underlying medical conditions, May right now would be a good time to consider a booster shot. If you're vaccinated any time more recently, keep an eye on the calendar and try to time when you get your booster for that time frame. Anybody who got the Johnson & Johnson, if it's been more than 2 months, you should get a booster shot. Now, let's talk a little bit about booster shots. They recently came out late last month approving a mix and match. So What that means is that regardless of how you started your series, if you got 2 doses of Moderna, 2 doses of Pfizer, or 1 dose of Johnson & Johnson, your booster shot, whether it be after 6 months or after 2 months for Johnson & Johnson, can be any of the 3. So because of the way they studied the vaccines and the way they studied the immune response, it doesn't matter what you get, but it is recommended that you do get a booster. So, whatever you choose to get, it might be beneficial to find one in the community. And we'll talk a little bit about that in just a second. As far as the vaccination and doing everything that Aaron talked about a little bit to prevent the virus from spreading, it's a team sport. We're all in this together. We live in this community, and we, our neighbors are the people that we care about, and we have to get more people vaccinated, which reduces the level of transmission, reduces hospitalizations and the stress in the hospitals, and reduces the deaths, because it's important to do that. So people might ask, why should I get the vaccine? And that is exactly why. And it's also for people who cannot get vaccinated. Young children cannot get vaccinated. Seriously ill individuals who may have gotten vaccinated, or they may not be able to because of whatever illness they have, and maybe even people with allergies to the vaccines. Those people rely on everybody else to get vaccinated to help protect them. It's a level of protection for everybody. And you might ask, do you still need to keep wearing a mask if I'm vaccinated? Certainly, it's a recommendation. Most stores you go into have suggestions or recommendations. Not everybody is vaccinated, and you don't know if they are. So wearing a mask protects you. It protects everybody else. Certainly indoors is recommended. Aaron and I are both wearing a mask right now. It's a strong recommendation to just reduce the spread of the virus. And if you've had COVID-19 already and you feel that you're immune and you haven't been vaccinated yet, the CDC does still recommend that you get vaccinated. There's great evidence suggesting that getting a shot, getting the series for any of them, it shows benefit in preventing hospitalizations and deaths. So it is recommended. And if you are wondering where you can get your COVID-19 vaccine, if you go to vaccines.gov, there's plenty of places you can go. There's also obviously places in the community, local pharmacies, CVS, Walgreens, Walmart. There's other places. A lot of them, though, at the current time, because more people are getting vaccinated and more people are looking for places that have maybe specific ones, they're requiring appointments. So I would get on your phone or on the internet and try to find what local pharmacy you'd like to go to, or local medical clinic, and trying to schedule the appointment. That way you don't show up, find out they won't be able to take you that day, and then kind of waste your time. So that's kind of the best way to do it right now. Now, if you do get vaccinated, you will likely experience some adverse side effects. So those can be because you're getting a needle into your arm, you might feel pain, you may feel redness, you might get some swelling in that area. And that's pretty indicative of any vaccine that you get, whether it be coronavirus, the flu shot, or a shot you got previously like a tetanus or something in your youth. And similar to those shots where you kind of feel a little bit tired afterwards, you might have a headache, muscle pain, chills, a fever. It might cause some nausea. It can also cause some inflamed lymph nodes. That's a pretty common thing. That's your body reading and interpreting what the vaccine's doing to it, and mounting an immune response to get ready for in the event that the actual virus needs to be fought off. So that is pretty normal for the vaccine. If you're experiencing any sort of serious adverse effects you feel came from your vaccination, certainly call your healthcare provider. If it's an emergency situation, you should definitely go to the emergency department. That being said, you don't catch COVID-19 from the vaccine. It teaches your body to fight against COVID-19, but it does not give you COVID-19. So here is a little bit of information. I talked a little bit earlier about the vaccination rates and hospitalization rates. So this graph here does a really great job of depicting it. On the left-hand axis here, it's the rate of hospitalization in 100,000 people. And on the bottom here, it starts at January of 2021, which is about when the vaccines got introduced to the public. So as you can see, the hospitalization rate in the blue has always been higher. Then in the which is the blue is unvaccinated people, the green is vaccinated people. So the blue's always been higher, and there's a little bit of a spike in the May and April and May timeframe, and then as the Delta variant became more prominent in the United States, you can see a large uptick right around the July, August timeframe, where hospitalization for unvaccinated people really took off. In Utah specifically, vaccinated people are 19 times less likely to die of COVID-19. They're 12 times less likely to be hospitalized and 5 times less likely to test positive for COVID-19. So those numbers are based off the testing they're doing in the community, the hospitalizations. So it's pretty strong. And specifically, so that's a macro level of Utah. And we can talk a little bit smaller, specifically here at St. Mark's Hospital. We've had 1,160 confirmed COVID positive patients since March 2020. So that was kind of the start of the pandemic, so to speak. 96% of those inpatients, the people that have been staying with us for treatment for COVID-19, have been unvaccinated. So that means 4% were vaccinated. So that's the chance of being hospitalized is 24 times higher if unvaccinated, specifically at our facility. And again, with the new Delta variant, there's a rise in the amount of COVID positive ICU level care, and the ICU is only a unit that can only be expanded so far. So it's difficult to care for everybody if people aren't getting vaccinated and they're being hospitalized. So, and more patients are also coming in younger. So maybe previously we were under the impression that a lot of the older population was at the biggest risk, and that's certainly still the case. But COVID-19 does not specifically target just old people. It's all ages. We see 30-year-olds, 40-year-olds, 20-year-olds. People get COVID-19 and they get ill, and they get more ill when they're not vaccinated. In total, we've had 156 deaths here since the start of March 2020. 50 of those coming since the beginning of August, and that was kind of that time frame with the Delta variant. And of those 156, 150 were unvaccinated and 6 were vaccinated. And those people did have underlying conditions. Certainly the unvaccinated people did too, but it just goes to show that if you have comorbid disease states, if you're experiencing other illnesses, and it's important, all the more important to get vaccinated. And this is also a gentle reminder. We are in the later stages of fall, early winter, and we're going to spend more time indoors, and the flu is going to kind of be in the community more with the winter months. So you can get the flu vaccine now. It's available in the community. So local pharmacies, your doctor's office, things like that. You can get the COVID vaccine and the flu vaccine. And the benefit there is that you can get them at the same time. So if you're looking for your first dose ever of the vaccine, or if you're looking for a booster shot and you also need a flu shot, you can get both on the same day and kind of kill those 2 birds with 1 stone. That way, if you don't want to experience the soreness of the arms twice, maybe you can do it on the same day. And as far as the COVID-19 illness, we'll talk a little bit here about the symptoms, the side effects, and compare them to other respiratory illnesses that Aaron talked about earlier. So this chart is a little bit busy, but it basically showcases on the top COVID-19, influenza or the flu, the common cold, and seasonal allergies. And on the left column here, it shows the different symptoms you might experience. And we're going to touch on the ones that are highlighted in yellow so we can kind of compare and you can kind of differentiate in your own head if you're experiencing something, what it might be. So specifically for COVID-19 and the flu, a fever may be associated with it. Not always, but it might be associated, whereas in the cold and seasonal allergies, it's a little less likely. So if you're experiencing fever, it's kind of a red flag. A fever being a temperature above 100.4 degrees is considered a fever. So if you test your thermometer at home and you have a fever over 100.4, it's kind of your first sign that there's something amiss, something going wrong. If you're also experiencing a cough, the cough with COVID-19 and the flu is usually a dry cough. You're not usually producing any mucus with it. It's more dry, whereas in the cold, that's very unlikely. And seasonal allergies, it is often. So it's kind of hard to differentiate with just a cough, but that dry cough might help you determine if it's the flu or COVID-19. And from there, if you're having a runny nose, that's more associated with the cold and seasonal allergies. So you may not suspect COVID or the flu as often. Thought there was another question coming in, so we're good. So finally, I wanted to touch on runny nose. So a runny nose, you can still get a runny nose with COVID and the flu, but it's more often associated with the cold, a common cold or seasonal allergies. So I wouldn't rule out COVID-19 if you have a runny nose, but it might be a reason for you to kind of get tested to see if you do or do not have COVID-19. And we'll talk about that in just a second. As far as COVID-19 specific, kind of the big red flags is the shortness of breath, difficulty breathing that we see in patients with COVID-19, and then the loss of taste and smell, which either maybe you experienced or a friend of yours who might have had COVID, or you maybe saw it on the news. That's a pretty common one. That's specific to COVID-19. So if that is happening with you or any of your family members, it's definitely very suspicious of COVID-19, and you should get tested. So we'll talk about testing. So if you have symptoms of COVID-19, it would be definitely recommended to get tested. If you come into close contact with somebody who is known to have COVID-19, you also should get tested. For vaccinated people, you should get tested about 5 to 7 days after exposure, whereas unvaccinated people should get tested immediately. If they are negative, they should still get tested 5 to 7 days later. We call that the incubation period. It takes the virus a little bit of time to kind of build up in the body. So you want to, if you're negative, it doesn't mean that you're going to stay negative. It might just be you got introduced to the virus and it's going to build that kind of what we call a viral load. It's the amount of virus that's in your body. So it takes a little bit of time. So you want to make sure you did not get the virus. So it's important to get tested again. And unvaccinated people who take part in activities that might put themselves at risk, any sort of large indoor events with people, a lot of people, that could be a serious situation where maybe there's somebody in the crowd or in the community who does not have, wasn't vaccinated, or they have a breakthrough infection, which do happen with the vaccine. It would be important to get tested there. And if you're experiencing symptoms and maybe you talk to a healthcare provider, or your healthcare provider just asks you, hey, why don't you get tested for COVID-19? Definitely a good idea to get tested. And you might ask how you can get tested. There are testing sites in the community. So you can go, the state of Utah has a website where you can sign up, can find locations to get tested. And there's also pharmacies and things like that that offer testing. And there's also over-the-counter tests, so you can buy them at the store, and those are the rapid antigen tests. So this chart does a pretty good job of depicting the 3 different types of tests. The 2 on the left are more common. It's the molecular PCR test, and that's kind of the little nasal swab they'll stick up your nose, or they even have a saliva sample you can spit into a little vessel, a little jar, so to speak, and that's going to tell you if you have a current or recent infection, and they're very accurate. The PCR does a great job of detecting the virus in small amounts to see if maybe you have a current illness or a recent illness, whereas the antigen, that's what we associate with the rapid test. They call it rapid because you can get this done, and the results now come in about 15 minutes. So they sell them at drugstores. You can buy them at Walgreens, CVS, Walmart, things like that. It's usually a 2-pack little kit, and you can do a test at home. They work the best when you are actually experiencing symptoms. So if you're not experiencing symptoms, you can still take it. If it's negative, that does not mean you don't have coronavirus. It just means that maybe your viral load, that level of virus in the body, isn't high enough to detect. And it also might mean that maybe you had the virus and that your body fought it off enough where the level is not high enough to detect, but you could still be contagious. So just because you have a negative test does not mean that you are negative as far as a rapid test. But if the PCR test is more accurate, so if you test negative with the rapid test, you should still get tested with the PCR, but the rapid test might give you a better idea. Should I go to work today? If you're positive, definitely don't go to work. If you're negative, probably still a good idea not to go to work and get a PCR test just to confirm. On the far right column is the serological, the blood testing. And that basically means you have to have a blood draw, and it's going to detect the COVID-19 antibodies in your blood, and that would indicate that you had a past infection. Those are relatively rare. Some places are doing them. Laboratory tests you can buy, or sorry, you can purchase the ability to go a place and they can draw your blood, or maybe your healthcare provider, but they're much more rare. So definitely if you're looking to get tested for an active current infection, you want to do a PCR or antigen test. And with that, I'll pass the baton back over to Aaron, who will talk a little bit about symptom control and what to do if you have COVID-19.
All right, so yeah, if you do get COVID-19, there are drug-specific treatments that you can use. Those are specific towards the hospital. But if you are at home, we do have over-the-counter products to help with symptom control, and we'll talk about both of those now. For COVID-19 specific treatments, there's a few different ones that you guys have probably heard of in the news. But the ones that you think of or you might have heard of is dexamethasone, remdesivir, tocilizumab, and baricitinib. And they work slightly differently from each other, but dexamethasone, tocilizumab, and baricitinib work by suppressing the immune system. As we saw in that video that we watched earlier, your body's immune response can kind of hurt itself or hurt your own body. So what these medications are kind of doing is suppressing that immune response a bit to kind of lessen the symptoms that you may experience. As for remdesivir, this works a little differently. This is an antiviral agent. It's used earlier in the diagnosis of COVID. And basically, when someone comes into the hospital within so many days of being tested positive for COVID, you can use remdesivir to kind of suppress the virus from keep replicating. But something I do want to mention is that for hydroxychloroquine and ivermectin, you should not be using these for the treatment or prevention of COVID. There's no data suggesting that this benefits anyone who has COVID or from getting COVID. So it's not recommended. So what happens if you do get COVID-19 and your symptoms are not severe enough to go to the hospital, but you want to manage them at home? There's a few different things we could do. There's a lot of over-the-counter medications that can target specific symptoms. So there's pain relievers and fever reducers, there's decongestants, there's antitussive and expectorants, which are basically helping with your cough, and antihistamines. And we'll talk about each of them in their own slides in the next couple slides. So pain relievers. So the pain relievers we typically think of is Tylenol, which is also known as acetaminophen, or NSAIDs, which is also known as a non-steroidal anti-inflammatory. And the big NSAID that we think of is ibuprofen. Other NSAIDs can include naproxen and aspirin. And all of these, like I said, are pain relievers. They relieve pain like muscle aches, headaches, and even fever. So if you do have a fever, you can use these to kind of control your fever. Something I do want to mention about Tylenol or acetaminophen is that it is present in many over-the-counter products as a combination product. So like if you think about Dayquil and NyQuil, typically it includes acetaminophen. So if you're taking Tylenol extra strength by itself, and you're using other over-the-counter product medications to kind of help with symptoms, you always want to double check to make sure that Tylenol is not in them, because if you're taking too much Tylenol in one day, higher doses can be harmful to the liver. So always double check the back of the package or the back of the bottle to make sure it does not contain acetaminophen. As for NSAIDs, you want to avoid NSAIDs if you have reduced kidney function, high bleed risk, or heart disease. And something else that I do not list here, you also want to avoid aspirin in someone who's sick with someone who's younger, typically younger teenagers and children. As for cough suppressants and expectorants, we have two different ones here, dextromethorphan and guaifenesin. Dextromethorphan would suppress a cough. So if you're coughing a lot, it typically helps at kind of reducing the amount of times you're going to cough. Whereas guaifenesin really works by breaking down the mucus in your lungs, mostly so it can help you cough up that mucus. So they work slightly differently. If you have a dry cough, using a cough suppressant is probably is the type of medication you'd want to help with the cough. Whereas if you're actually coughing up mucus, guaifenesin is a better choice because it can actually break up that mucus and help you get it out even more. And something else is that you kind of want to avoid combination of both of these products in one because they're working slightly differently. The cough suppressant is working to suppress your cough, whereas the guaifenesin is working to break up the mucus so you can cough it up. So it wouldn't really make sense to use them together, but there are over-the-counter products that have them in combination with each other, such as Mucinex DM. So this is one product to really kind of avoid. And then based off if you have a dry cough or a cough with a lot of mucus, you can kind of determine which product or which medication you want to use for yourself. As for decongestants, these are great at relieving a stuffy nose or like if you have a lot of nasal congestion at that point. Products that really help with that are phenylephrine and Sudafed, and also nasal steroids. Phenylephrine and nasal steroids can be found over the counter in the aisles like Tylenol or ibuprofen and all the other products we're talking about. Pseudoephedrine is different where you actually have to go to the pharmacy counter and talk to the pharmacist to buy it over the counter. You don't need a prescription to buy pseudoephedrine, but it is regulated, so that's why you have to go to the counter and buy it from the pharmacist. Something to keep in mind for both phenylephrine and Sudafed is that it can increase your blood pressure. So if you do have a history of high blood pressure, it's something to note when you are taking these medications that it will increase your blood pressure and it may look a little uncontrolled during that time. And then antihistamines. So antihistamine, that's your medication like Benadryl that we think of. These work by relieving itching, watery eyes, sneezing, rash, itchy eyes, throat or nose, runny nose, cough, and nausea. So they work with a lot of different possible symptoms. And there's two different types of antihistamines you can buy over the counter, drowsy antihistamines and non-drowsy antihistamines. Drowsy antihistamines is like your Benadryl that we think of, which is also known as diphenhydramine. Another drowsy antihistamine is doxylamine. Your non-drowsy antihistamines are loratadine, cetirizine, and fexofenadine. Loratadine is also known as Claritin, where many of you guys might know that one more as you see that in commercials and stuff. But something to point out here is that if you do have symptoms such as the ones I just listed, sorry about that, that with a cold, that the drowsy antihistamine will work better than the non-drowsy ones to kind of relieve those symptoms. So those are the over-the-counter products that really help with the symptom control when you are sick. As for other non-pharmacologic remedies that you can use, the two biggest ones that we think of, honestly, just rest and hydrate. Your body's building an immune response and using a lot of energy to fight an infection. So the best thing you can do for your body is just rest and stay hydrated. Other things you could do is humidifiers and saline rinses are great for congestion and sore throats. Chicken soup and bone broth, sore throat lozenges, honey and warm tea are great for a sore throat and cough as well. And vitamin D, C, and zinc. Those are great at boosting the immune system prior to getting sick, and it can kind of help reduce the symptoms in a sickness that you might eventually get. Zinc of those three is best if you are sick, where it can actually reduce the severity of your symptoms, and it also shown to kind of reduce the length of your infection that you may possibly have. So when should you decide to go see a doctor if you do have COVID? And I list them here. Oxygen levels less than 90%. You can buy a pulse oximeter to measure this. You can buy them for like 20 or 30 bucks at Walmart or online at like Amazon. And it'll tell you your oxygen level, and usually it'll also tell you like your blood pressure, or not your blood pressure, but your pulse. But if it reads an oxygen level less than 90%, it's probably a good time to go see your doctor or go to the emergency department. Along with that, if you have significantly shorter breath, if you have a persistent high fever, if you have persistent pain or pressure in the chest, those are all good indications to go to the emergency department as well. And the last couple ones are in regard to if you do have low oxygen levels. So if you have a blue tinge to the face or lips, difficulty waking up or staying awake, confusion or worsening confusion, or reduced consciousness, those are all indicative that you have low oxygen levels, and you should probably go to the doctor and they can treat you properly at the hospital. And that's about all we have. Thank you. Do we have any questions? I think we might, because it looks like
You guys see the questions? There are a few questions there.
yeah, what we noticed during the presentation is that when you guys would type the question, it wouldn't scroll down for us. So we just saw the first question, which is why we might have been missing them throughout the presentation.
So the first one is, are most COVID cases at this point the Delta variant?
Oh, I don't even see that question here.
Oh, it's just
Yeah.
I can answer that. Yes, they are.
Yeah, so the cases we typically see here in the hospital are the more severe cases, and yes, it is the Delta variant that we are typically seeing, and that's more of the surge that we've been seeing more recently in the last coming month is because of that Delta variant. So yes.
Right. Next one is, do you know if we will need to get a booster every 6 months, or is this dependent on the spread of the virus and if different variant forms?
Yeah, that's a great question. I think a lot of us would be wondering that, um, and I think the answer is kind of unknown. That's why, initially we thought that the initial series might be beneficial and be enough, but with the Delta variant kind of spreading through Europe and then coming to the United States and getting that curve going up, they saw in the clinical trials that the people that were vaccinated had a reduced hospitalization and death, and with a booster shot. It is important that you consider that if you're eligible. And going forward, they're going to kind of have to react to the data they're seeing as far as if a booster shot maybe every 6 months or a year, or they may discover that 3 shots is enough. At this point in time, we're just kind of following whatever the data shows, and if it shows reduced hospitalizations and deaths from additional vaccinations with minimal side effects to the vaccination, I think they may continue to recommend that, but it remains to be seen exactly how often, or if often, we will be getting additional boosters beyond that.
Okay, thank you. While you were talking, I had a question about that. So most of us have had measles, mumps, rubella shots, things like that. Why did we just have to get 2 or 3 of those, but we're not sure with the COVID how many we're going to need? It's like
So part of
once you
that, I
had
think,
the
is
other shots, you were pretty much done with it.
yeah. So there's years-long evidence that having that immune response to those viruses through vaccination or having the illness sticks around for years and years and years. As it stands right now, the data is showing that if you get COVID-19, they talk a lot about the durability of your immune response. And it does show that immunity diminishes and it does go down. What similar to kind of like the flu, you get the flu vaccine every year, and that's because there's a different variant every year. So we have a new variant in the Delta variant, and we saw hospitalizations and deaths start creeping up. A vaccination was needed because the vaccination initially wasn't enough, the 2-dose series or the 1-dose series. So they're kind of reacting a little bit to the data. They're doing, I think, the best that they can with this new virus. Measles, mumps, rubella, they've been around for decades, and this is a new thing. And I think they're doing their best to try to educate and protect the community as best they can. So as it stands right now, knowing that the immunity wanes, it's appropriate that you would need to get kind of vaccinated, even if you had even if you had the illness.
Austin, this is Jennifer. I just wanted to add to that is coronaviruses are very different than the measles virus from the rubella. It's more similar to influenza, where we do see the waning immunity a little bit. So it's like comparing apples to oranges. Yes, they're both viruses, but they both are very different from each other. Also, we are reacting to a current global pandemic, and we are not currently dealing with that. With measles, it's not rapidly mutating, so we don't have to have that knee-jerk reaction that we are having to deal with in our current pandemic. We think we have it under control, it mutates, it goes wild again. So the answer is we don't know. But as far as comparing it to MMR, it's just a different virus. It's a different ballgame.
Great, thank you. Next question is it possible post-COVID to not have antibodies but still have T cell memory? And is there a test for T cell memory for COVID?
I can answer that one. So the question stems, I think, from the fact that as you have antibodies and you're not being exposed to something, your body will stop creating the antibodies and store them in your T cells and your B cells, which are also part of your immune system. So I would have to look up to see if there is a test for T cells. If there was, it would be expensive and not widely available. However, if you don't have antibodies currently in a pandemic where the risk of catching a virus is actually quite high, I personally would go ahead and get boosted at that point. There also might be some underlying, maybe immunodeficiencies that you might not know about. But so if you are somebody who have had 3 doses of your vaccine, and you still don't have antibodies, I would go ahead and make an appointment with your doctor, as you would be the kind of the outlier in that situation. Did I answer the question? I guess is I need to ask.
I don't know. To me, it sounds like you did.
Okay.
Somebody's wondering if children under 5 will be able to get it soon, the vaccine.
They're hoping by January. It's coming soon, hopefully within the next several months.
Okay. What seems to be the tipping point for someone who is unvaccinated to finally get the shot in your experience?
I think for Aaron and I think part of it, family members who see their significant others or their family member have COVID and have a robust response, they're hospitalized, they're having a hard time, and sometimes that leads to ICU level care. Sometimes that leads to the patient having either long-term, issues with their lungs or things like that, or it can lead to death. And when that happens, I think people kind of get that shock level, but it doesn't have to be the case. Getting vaccinated is a simple step. Obviously, you have to deal with the initial getting the injection and dealing with maybe some sleep, some tiredness, some muscle pain and things like that after getting vaccinated. But I think from what I've seen, the thing that moves people is when they have somebody that they know that either experienced it bad or it passed away, and it shouldn't take that because as you can see, the St. Mark's numbers, we've had 50 people die here since August, which is a huge number, and it's gone up extremely high recently. So I think that if you're unvaccinated, definitely have a strong consideration, and hopefully some of the information we shared might help you make that decision.
And feeding off of that, Austin, I think it's important too that as people are deciding whether or not they are going to get vaccinated, making sure that the sources you're looking at are actually credible sources. I think this current generation is getting so much of their information from social media. The news sometimes can be misleading as well. So making sure that if you do have specific questions or concerns, first of all, that you're being open as you talk to a healthcare provider, such as a pharmacist or a doctor, sharing your specific concerns. If you've read an article that maybe you're concerned about, bring it to us. If we don't know the answer, we can help you find the answer that you're looking for. But, coming from healthcare workers who work in a hospital who are seeing people die, who, unfortunately, I think that there's so much misinformation going around. The way we see it, those were preventable deaths. And unfortunately, we're still seeing so much death from COVID-19. So I think, just if you're on the fence, have an open and honest conversation with a healthcare provider about your specific concerns is my recommendation.
Great, thank you. We are over time, but I really appreciate. I thought the information was excellent. I learned a lot today. So I'd like to thank the 3 of you for doing this presentation, and I'd like to thank, I'd like to thank OSU Tanner and NYUP.
Did you want us to run over the learning objectives real quick?
Really quick.
Okay, and we can even just post them and they can read them themselves as they're logging off as well. But we'll run over to that slide.
All the way back. 1 second. All right.
Right here.
Great. Thank you, everyone. And everybody have a good day and a fantastic Thanksgiving.
You too. Thank you very much for having us.